that brings us to your weekly capsule of health information. We like to call it your healthy dose. We're going to talk about flex spending, not necessarily with your muscles, but with your mind. Here to tell us a little bit more about what to do is Andrea Scott with Hannibal Regional Medical Group. Andrea, good to see you.
Good morning.
Good morning. Thanks for joining us.
Thank you.
So a lot of us have probably already opted in or opted out of our employer's so-called flex spending plan. Just basically in a nutshell, what is flex spending?
Flex spending is an opportunity to defer funds pre-tax into an account that will allow you to then use your dollars after the fact, obviously, to be able to pay for out-of-pocket medical expenses. Basically, in a nutshell.
Okay, all right. And especially with the Affordable Health Care Act, some of us have different opportunities, especially with maybe perhaps a higher deductible. This is where this really starts to come into play.
It does. When you have high deductibles, co-pays, or just things that aren't covered through your medical plan, gives you an opportunity to shelter some dollars pre-tax, so you're not paying tax on those dollars, and then able to pull those funds out within the year to pay for those medical expenses. It's a great opportunity for a person that has that opportunity through their employer.
So this is basically, it's a savings account set aside, but it needs to be dedicated to those medical expenses.
Exactly, and it's very specific. The IRS has outlined allowable medical expenses, so there's an extensive list. So not everything is allowed to be able to be submitted to your flex spending account, but quite a few things. And of course, if someone was looking for those that listing, utilize the IRS website. There's a link that you can find allowable medical expenses. But the key, I think you mentioned, is you have to use them within their year. Most or all plans follow a calendar year. Of course, we're getting to the end of the year, so hopefully folks have looked at their balances, know what they have, what they've spent, have a few days obviously left between now and the end of the year to utilize those funds. But the nice part about it too, the IRS does allow a grace period. Not every employer has to allow the grace period. Again, check in with your employer. But if you don't use those funds by December 31st, you have an opportunity up to 2.5 months after the end of the year to utilize. So if you had $400 or $500 left in your spending account, didn't get them done at the end of the year, you might have that opportunity for that grace period.
Okay, so it's not like I totally lose everything, but I need to be a little bit more responsible.
Absolutely. And again, not every employer is subject or is allowed to have the grace period, so you really need to check in with your employer, check to see what your plan allows. And again, be aware of what those rules and regulations are. If you do not use the funds for medical expenses, it is a use it or lose it. So if you don't get those funds spent, you lose those dollars. That's not something that will come back to you. Okay. So have to be very careful.
So what's the best way to manage your visits throughout the calendar year to best utilize this program?
It's kind of hard to look into your crystal ball to know what medical expenses you're going to have for the next year. So I recommend for patients that ask me that question, take a look at what you spent from the year before or the last couple years, kind of get an idea of, maybe you've been having a shoulder issue or a knee issue, or maybe you are going to have some vision services or something coming up in the next year. Again, take a look at what you've done previously. Then going into the next year, again, you should get statements from your employer on a monthly basis. And if you don't, check in, make sure you just ask the questions. I definitely recommend patients to take a look at their accounts at least on a quarterly basis to see what funds they've spent and what they have remaining.
That's a really good idea. It's going to help all the folks in the medical community who are right now taking all the calls of people wanting to get in before the end of the year to utilize these dollars, and they're going, we just don't have the room. We're trying to, the doctors are wanting to go on vacation. Our staff is planning this. We're totally booked. Sorry, we can't help you. And then you've got upset patients.
Like I said, I really recommend most patients to take a look at it at least quarterly. Take a look in March, first part of April, see what you've spent, check in again, midsummer, and keep up on it, keep track.
That's definitely good advice. Is there any way to set this up with your employer that you can get more than what you put into it? Do employers match Flex at all?
Not on the flexible spending account. It is a program where you contribute the dollars pre-tax.
So it is important that you use them because that's your money you're going to lose.
Absolutely.
Okay.
Absolutely.
Andrea, take, for example, if there's an employer that doesn't offer a flexible spending account, is there a way that we can set one up externally?
No, it has to be an employee
It
sponsored.
has to be done through an employee-sponsored Flex.
There's a lot of hoops that the employer has to jump through with the IRS to set the plan up. It's very regulated. So unfortunately, if your employer doesn't offer that service, it is not something that you can take advantage of.
But as you say, if you get to the end of the year, you haven't used all your money, you can go to your employer and say, can you give me a little bit more time to utilize this?
And again, it's not, and the employer doesn't have an option to give it. It's the regulations by the IRS that deem if you can have that grace period. So it's something that your employer will have had to work through their plan to identify and set that up for you.
Okay.
So hopefully my employer, I have that opportunity, which is wonderful. I know myself, I've got a few dollars that I probably need to spend in mine. And, the 3 of the 4 of us in our household are eyeglass folks. So we'll probably be taking advantage here pretty quick by the end of the year and getting scheduled.
Well, and 2, it's a good program if you do know that you'll have medical expenses because you're not paying tax on these dollars that you've earned.
That's correct.
So if you
correct.
end up not utilizing 33% of what you've put aside, you're actually still breaking even with if you had paid taxes.
You're correct.
Essentially.
You're correct.
Okay.
So I tell people not to sweat it too. If you've left, $20, $30, $40 in your account, it still is an opportunity where those dollars are going in pre-tax and you're not paying tax.
Is there any way during the year you can put more money into it? What if you're going through it a lot faster than what you thought you would and you're wanting
No.
more?
Once you have the enrollment period, most employers have an enrollment period sometime between October, into the end of November. Some may go into December, but once you identify what those dollars are, there's no additions or deletions
set.
throughout the year.
Okay.
All right. It sounds great. Is there any resource that we can get more information?
We at the medical group would be more than happy to try to help answer any questions. I would obviously recommend to go back to your employer. Hopefully they have a human resource specialist at their location that can help. Would be my recommendation, but would be happy to answer or help and answer any questions of allowable expenses. And if folks are looking to the end of the year and trying to get in, please give us a call. We've got a lot of providers that are around if dealing with some health issues or want to try to get something finished between now and the end of the year, give us a call. We'd be more than happy to help.
Sure.
right.
It's important to you that people use these dollars and that they use them properly and that you
Absolutely.
all work together to make it
Absolutely.
come out at the end.
Absolutely.
All right.
All right. Good information there. Andrea Scott, thank you very much.
Thank you.
Andrea is with the Hannibal Regional Medical Group, who brings you your healthy dose along with Hannibal Regional Hospital. More information online, hrhonline.org.